Yeah, absolutely. So we have lagging indicators. So normally when we see indicators, the case numbers rise first, positivity rates rise first, and then follow the hospitalizations. After that, we have hospital capacities that in a lot of states reach maximum capacity and surge capacity. And then what we have is a lot of these sick patients on ventilators receiving really high level therapies. Sometimes they're on ventilators for 4 weeks, 6 weeks, longer times. And eventually, unfortunately, a lot of these patients end up passing away or in some cases, withdrawal of care based on the family's wishes. And so that's essentially why we are now seeing the effect of the record number of cases in a lot of places like Texas, Florida, and Arizona now.
So at the beginning of the show, I had talked about the surges that we are seeing in the states, in the Midwest and in the West. I mentioned South Dakota and Oklahoma. Why are these more rural areas being hit now? Is it because of the reopening? Is it because of a lack of perhaps mask wearing? Why are we starting to see these surges moving away from these more urban areas into these more rural areas?
Yeah, so I'd say all of the above. I think a lot of these Midwestern states didn't see the community spread that they're seeing now. And so we saw the East Coast rise in cases, and then we saw the rise in cases in Texas, Florida, Arizona, the southern areas. And now we're starting to get into those kind of more rural Midwestern states. I think the message here is heed the warnings. In Texas, we saw a rise in cases, a rise in positivity rates, and we really didn't do much about it. And then we saw a rise in hospitalizations. And once our ICUs were at capacity, that's when we started to roll back reopenings and put in place mask orders. And that was essentially too late. We lost a lot of lives. In Texas, yesterday, for example, we had 306 deaths. That is only the third time that we reached that threshold. And so for the Midwest states, a lot of them in the rural areas, they don't have mask orders. And so I would urge those leaders to put in place those orders. And even if you don't have orders, I think us as citizens need to realize that masks save lives and that we need to wear them, because that is the one thing that we found saves lives at this point.
I want to ask you about the school debate that we have going on around the country. Here in New York, Governor Cuomo said that schools are going to be reopening in the fall, but we've seen some pretty alarming pictures from schools that have already reopened. Children or high school students crowded in hallways, maskless. I mean, is reopening schools the right call, or is perhaps the way that we are reopening schools right now not the right way to go about it?
I think once again, an issue that is related to this virus has been politicized. And so we're having too many conversations of, who's controlling this decision, the states, the local governments, the federal governments. I think it needs to not be a debate, but a conversation between all levels of government to see what the best decision is. So I think, for example, New York and Arizona have good guidelines. They have guidelines based off positivity rates. And once those positivity rates are at a certain threshold, the state level will allow school districts to allow students to come back into the classroom. Now, if they don't wish to because of situations on the county and city level, then that's fine. And so I think it needs to be a decision that states support local school districts, and then school districts find out what the best model for them is. Is it a hybrid model? Is it a staggered model? What their cleaning protocols are? And I'd emphasize that testing still plays a big part. Having a positive in a class and then getting everyone tested, not knowing the results for 7-10 days is unacceptable. We need quick turnaround time so we know which students need to stay at home and then which students can come back if that is the model for that particular school district.
Doctor, I want to ask you one last question about the aid that we're seeing going to different states. We've seen the president, we've long known that the coronavirus has become incredibly politicized. The president singling out Texas and Florida, of course, those are two states with Republican governors, for essentially coronavirus help. I mean, what are your thoughts on a move like that, especially as we're seeing other states, California, for example, still being a hotspot?
Yeah, once again, it's unfortunate that things are politicized. As doctors, we like to focus on the science and the facts, but I can't help seeing this as a political move with Texas and Florida getting that aid. I think one thing we've learned through this pandemic that works is good policymaking and that being based on public health measures and science. And I think at every level of government, whether that's the federal level, state level, city level, we need to base those decisions on those facts that we all know about. And so I think every community, whether Republican, Democrat, rural, urban, needs to get the full support of the federal government during this pandemic, because without that, we're essentially lost. The other thing I'd point out is that we know that the coronavirus, as a family of viruses, has high transmissibility in colder weather. And so as we head into the fall and winter season, we need more federal support, not less federal support.